So I'm just gonna get started because I'm aware of the time limits that we've got. You'll notice that this is a slightly different group compared to the one that you previously were in. And we are now going to focus on the key place-based priorities. In this room, we are going to be looking at Leeds locality. And although we will all bring sort of like different perspectives into the conversation, and our discussion may also include region-wide considerations. So as before, you've got the, if you would like to talk, you've got the reaction bottom at the bottom of the Zoom screen, or if you've got your camera on, just give us a wave. We'll need to do some thinking and brainstorming together, so it might be that we move to a more sort of like natural conversation style. So feel free to just mute or unmute yourself, and please be mindful of other people if they're speaking. So in this room, we'll be looking at exploring the key barriers and drivers to building more inclusive digital transformation. And from that discussion, identify the key priorities, which we then will share with the rest of the group. Some of these priorities might be based for Leeds, and some might be wider. So the main thing we need to achieve in the next 15 minutes are to identify these key priorities, as I mentioned before. So let's start with spending a few minutes on discussing the key barriers. Is there anyone that would like to start the conversation about barriers? Anyone that would like to add something? I can't. So I think we've got 6 people in total. There you go. Hi, Christina.
Hi. I don't mind kicking off. I think it's similar to one of the. Oh, I recognise John actually. I know John. Hi, John. And Rosie's in the room. I know all these people. Yeah. I think one of the barriers for us as a large organisation, so I'm the head of patient experience at Leeds Teaching Hospitals. We've got an awful lot of staff, we've got an awful lot of clinics, we've got an awful lot of care being provided to an awful lot of patients. We've clearly had to look at, certainly from an outpatient perspective, how to deliver some of our services differently, and that for us includes remote interaction with patients via either telephone, requiring mobile phone use sometimes, or video consultation. I guess one of the challenges for me, I've been involved in, I cannot tell you how many number of conversations about digital exclusion in recent months, weeks. It's a topic of great interest for lots of people for all the right reasons. One of the difficulties I think we've got and that we're trying to get to grips with, we understand some of the difficulties, we understand some of the challenges. One of our challenges as an organisation is that I don't think I've got a handle on the people in our situation who are most likely not to attend appointments. So where we put in place digital solutions and we have DNA rates against those, so did not attend, so people just don't accept that invitation. I don't think we understand what cohort of patients that links to, such that we know where to start to target our attention. Accepting that everybody needs our attention, but if we were going to work on the principle of where do we start first to have the biggest impact for the most people, I'm not sure I understand that sufficiently to know where I would advise our work should begin. Does that make sense?
Yeah. So I'll just reiterate briefly what were you saying. I think you were saying that the problem is not understanding what cohort of people would need sort of help the most, how to individuate that kind of like what people are not participating.
I think we've got lots of intelligence from across the the third sector organisations, because I'm linked to Healthwatch, who is, you know, who are linked to third sector organisations. It's not that we don't understand that there are lots of communities that struggle, but what I'm trying to say is, as a massive organisation, we can't do everything all at once, and you've got to start somewhere to prove that you can find a new way of working. It would make sense to me to focus that attention in a direction that would benefit an awful lot of people to start with. And I guess I'm trying to get my head around who would be the cohort of people, where would the community be that we could start with first, thinking about how they're accessing video consultations and what more we could do to support them in that, for instance. I don't know if that's the right way forward, but it just seems a logical approach. I see that John had his hand up.
Oh, sorry.
So I want to interject.
Firstly, to back up on Christina's, the Health Watch report on digital inclusion, the Health Watch Leeds did, is absolutely wonderful. I'd really recommend reading that. Missed it in a couple of things, but not so badly. I think one of the issues we're going to have to deal with in Leeds, and it's true for most of West Yorkshire, I think, is partly a range of languages if we're putting out information, but it's also people accessing and reaching the people who probably mainly older, and unlike me, are having to learn how to be visually impaired or deaf or whatever, not had it all their lives. So on top of that, we're now asking them to come to grips with equipment and things they've probably never used before. So I'm going to come back, because I'm sorry, maybe I'm boring about this. I'm going to go back to this. We must always have alternative channels. And I always ensured in designing systems for the health service and in Leeds City Council that I did that we made sure there were still alternative channels so these people weren't disadvantaged. But that's one barrier. I think the other one is going to be the supporting service providers, whoever, whether that's care, health, whatever, in coming to this new environment and how to use it best. And one of the things I've been looking for and can't find anywhere is any meaningful study of any impact on the quality of diagnosis from this sudden move, the big move to GPs doing online consultations. We just don't know whether there has been a reduction in quality of diagnosis or not.
I mean, just to add on to what Christina was saying, I think that's something, who to work with first, Christina, is something that we have also struggled with. And one of the reasons for that, I think, is that there's no one definition of a digitally excluded person. So it's not easy to be able to identify who those people are, where those people are, in the way that you might be able to identify other groups of people. There are indicators, there are 6 main indicators as to things that might point to somebody being more likely to be digitally excluded, but that doesn't help too much in this way. And I think also around people not turning up to appointments, there's also more issues around that, around, you know, are people not being offered digital options because it's assumed that they won't be able to engage with it, or they won't want it because of assumptions around who is digitally excluded or not? Are there people that are not even coming for appointments because they're assuming that stuff's going to be done digitally, and they've heard that you can't get doctor's appointments and stuff like that, so they're not even coming to surgeries and stuff and asking for appointments? So I think it's really difficult. The route, I know this is about barriers and not about answering how we overcome those barriers, but one of the approaches that we've found has worked well is to use some of those indicators and look at big cohorts of people. If you want in a big cohort that we know there's likely to be a lot of digitally excluded people that are part of, or looking at which parts of the organisations are just keen beans, who wants to be doing something and gets it, is always a good place to start, because otherwise you can spend a lot of time trying to convince people of the way forward and that it's appropriate and stuff like that. But if you've got somebody coming to you beating the door down, it's a good place to start, basically. And from that, John mentioned the Health Watch report, the digitising Leeds, I think that there was quite a backlash from some organisations on that, feeling that they'd not been, the third sector organisations, feeling that they'd not been properly represented and wanted to be able to feed in. So some of those organisations are obviously desperately wanting to be part of that conversation and wanting to do stuff and offer support. So again, in some of the in these new localised approaches that we're doing with the LCPs in Beeston and Middleton and Bermondsey and Richmond Hill, we're working with some of those organisations that have wanted to have more of a voice because they're just engaged, and it's a good place to start. And they're organisations where you know that people, so we're talking about Leedsgate, I'm talking about like BASIS that supports sex workers in Leeds, organisations where, you know, looking at all those indicators, and the indicators are around literacy levels, are around age, earnings, money earnings, levels of formal schooling, can't remember, social status, all indicators that certain groups, including gypsy travellers and sex workers that are supported by this, are going to hit those indicators. And I think that's the best you can do, in a way. Either that, or if there's a tool. So like looking at the work around my COPD, that was because we know there were lots of people with COPD, but there's also a tool that we knew lots of people would benefit from using. So that was an opportunity that was there as well.
That's great.
Yeah.
Thanks, Amy. Just conscious of the time, shall we just briefly touch on enablers, for example, specific funding pot or COVID-19 evidence, just to mention some, and then get into the priorities. So in terms of enablers, what are your views on that? What could make things a bit easier where are like the main needs? I'm conscious that maybe talking about barriers, we highlighted already some points, but.
I noticed that John's put in the chat digital champions, and I'm assuming John, I'm assuming you mean that you see it as you see them as an enabler. Lots of people are talking about digital champions this moment in time. I hear that concept being linked to all sorts of different work. I guess one of my questions around that. So I think that's right. I think digital champions have got a part to play in the world of now and going forward. There is something about trying to find those people and them being the right people. And I know actually in work that we've done recently to engage members of the public to support the organisation that John actually kindly helped us with in the Trust, it's really quite difficult to find the number of people you think you might need sometimes to do that bit of work. So it's an enabler. There's also some challenge there, I think, in recruiting, finding the right people, and there's a question, isn't there? How can Leeds as a community, how can the City of Leeds identify the folk who could enable us all to support the people, the communities that we're linked to in whatever way that we are linked to them?
I mean, I think there's already some stuff. So if you have a look on the 100% Digital Leeds website, there's already different organisations that are offering, that have volunteers that are offering digital support that can be referred into. So I don't think it's necessarily about different, I mean, obviously looking at if you've got an opportunity with people that are already engaged to add a digital inclusion element into what they're doing, then I think that's only beneficial. But I'm not sure how much everybody finding their own volunteers to offer digital support is the best approach necessarily, because what we've found is that it's about having an existing relationship. They're the best, the people that have got an existing relationship, a trust relationship that understands the needs of their people, make the best people to be helping people to develop their digital skills. So like if there's already a setting, so like we've supported some digital champions in, I mean, this is pre-COVID, but in practices that and health settings that have got peer support groups or coffee mornings or places where people already come together and know each other, then that encouraging those to understand a bit more around digital and be able to offer each other support is sometimes more successful than recruiting separate volunteers kind of thing. So like, for example, with the My COPD app that we have been supporting people to use, a big part of that has been my colleague Rachel going around all of the Breathe Easy groups and making sure that all of those people are able to use it, and then training them all to be digital champions so that they're in a position to be able to advocate for the use of the app, but also help people to develop their skills. That alongside then going to the organisations that are already supporting the kinds of people who might be more likely to have COPD, so that they know that this app exists, and anything they're doing around digital inclusion support includes focus stuff on use of that app as well, because we understand.
Just conscious,
Sorry.
we've got less than 4 minutes to go through priorities.
Sorry.
Sorry for the time.
I actually think that helps me with a priority, if I can just interject for 30 minutes. That's really helpful, Amy, but I think our conversation has just shown that we are in danger as individual organisations of going off in our own direction. And there is something about, I keep going back to how big we are as an organisation and how many different clinicians there are, care pathways there are. There is a challenge and I think a priority, if work is already going on in the city, as you describe, to share that message in a way that is global. So actually that intelligence that you're talking about, you very confidently talk about, oh, there's all this stuff already going on, Christina. Fine, but those folk working in my hospital do not know that.
Yeah, I mean,
that I would say then is a priority, because that's really important, isn't it?
Yeah, and please get in touch with me separately so that we can have a conversation about how I mean, I can't see from your thing what your role is or anything like that, but there will be ongoing stuff that you can already tap into. And one of the assets or whatever we were saying, enablers, whatever it was, is 100% digital Leeds in Leeds, because that's our role as coordinators and bringing people together so that everyone isn't reinventing the wheel. But you're right, there's a lot of people to speak to, and it's just so hard and a lot of stuff going on to try and get out. And we do try and get out to like conferences and stuff like that, but it's just so tricky to be able to reach everybody. If you've got any ideas on forums or newsletters or whatever that we can put stuff in to reach everybody, then please let me know.
I think
And
I need to take
that's
this
a
back
work
to the
stream.
digital board for Leeds. I'm a member of the digital board of Leeds and Harrogate, West Yorkshire and Harrogate rather. So I think I need to take that back, and maybe we need to be doing a bit more promoting what's going on.
Yeah, agree, John. I think we all need to do a bit more.
But if anybody wants to, 10 seconds, amy.hearn, HEARN @leeds.gov.uk.
Share it on the chat, please, Amy.
I've
If you
shared
can.
it on the chat.
Yeah,
I'll share it again. I'll share it again.